Director of Compliance here at Hospice of North Idaho, and we're just going to talk a little bit about preventing falls in your home or in the facility today. So at HONI, we track all of our falls that our patients have, and the two biggest falls that we see is when a patient is ambulating, usually by themselves, or with transfers. So whether it's transferring out of a wheelchair or transferring off of the toilet into a wheelchair, another wheelchair, or on their own. So let's talk a little bit about the risk factors that we see with our patients, or just for falls in general. So number one is probably as our patients decline, or as patients are getting older, sometimes there can be some balancing issues. Lower body weakness is a big one. Another one is maybe some hazards or dangers in the home. Sometimes you've been living in your home a long time and you get used to having a chair in a place that you constantly trip over, or some oxygen tubing that's sprawled all over your home. And then also another thing is different medications can, the side effects can cause some drowsiness or sleepiness, which could potentially create falls or put you more at risk for falls. So talking about some of the ways to prevent them, a good thing is that if you're at home, or even if you are living in a facility, is have a healthcare professional come in and evaluate your environment. Sometimes we see little things that could be changed which could prevent a fall or tripping hazard, like taping oxygen tubing to the ground or extension cords to the ground, even shifting a chair just slightly so that a wheelchair can get closer, or you can pivot a little bit better in your home. And then also having your medications reviewed by either your provider or pharmacist is a big one. We see a lot of what we call polypharmacy, or a lot of medications all together, and sometimes the combinations can give you some pretty bad side effects. So getting your medication list reviewed by a pharmacist is always a great tool as well in our community. Thank you for listening.